When it comes to your child's health, panic isn't always the real danger. Sometimes confidence, especially when it comes too fast, can be just as risky. The moment you think, I know what this is because you saw a similar story online, because you have been through it once before, or because a short video sounded certain. Today I want to talk about a psychological trap that affects all of us, and then I will give you a simple, practical way to protect your child and protect your peace. Hi, I'm Dr. George Kamburoglu, pediatric surgeon. On this channel we focus on calm, clear guidance for parents. Not drama, not fear, just better decisions. This video is about the Dunning Kruger effect, not as a label, but as a pattern that can show up when we are stressed, tired, and trying to do the best we can. The Dunning Kruger effect is usually described like this. In a specific skill or knowledge area, people who are less skilled may overestimate how well they understand it. One reason is simple. To judge quality, you often need some of the same skill that create quality in the first place. But here's an important nuance. This effect does show up in research, but the way it's talked about online is often stronger than the evidence supports. Some researchers point out that part of the pattern may come from how confidence and performance are measured. When you compare how well someone performs with how sure they feel, the gap can look bigger than it really is. So use a simple, safer interpretation. When we are dealing with something we don't know well, it's easy to feel more sure than we should. And when we're stressed, worried, or exhausted, it becomes harder to step back and check our own thinking. That's when certainty can show up earlier than it should. That doesn't mean parents are doing anything wrong. It means they're human. Parenting is a high-stakes environment. You are making decisions while sleep-deprived, emotionally flooded, or time-pressured. And 3 modern accelerators. First of all, short-form content that rewards certainty and not accuracy. Second, search results and social media push the most clickable story, not the most typical one. And third, AI tools can sound confident even when they are wrong, and that confidence can rub off on the user. So, the risk is not that parents are careless, the risk is that parents are human. Let me give you 3 examples. Not panic, just clarity. Scenario 1. Vomiting plus abdominal pain. A child vomits, complains of belly pain, and you think, it's a stomach bug. Most of the time, it really is. But here's the danger. Confidence can make you stop observing the pattern. The safer question is the pain getting worse, localizing to the right lower side, or preventing normal movement? Is there persistent vomiting, fever, or does my child look increasingly unwell? Not because you must diagnose appendicitis, let's say, at home, but because you must choose the right next step. Second scenario, head injury. A child hits their head and seems okay. Then confidence whispers, they cried, they're fine. Sometimes they are fine, but you do not want confidence to replace monitoring. You watch for repeated vomiting, worsening headache, unusual sleepiness, confusion, seizures, or anything that feels off compared to your child's normal. If those show up, that is not a debate. This is an urgent medical examination. Third scenario, sudden testicular pain. This one is uncomfortable to talk about, but it matters. A boy has sudden severe testicular or lower abdominal pain, and then it improves. Confidence says, it went away, so it's over. But pain that comes and goes can still be a warning sign. And this is exactly where overconfidence can steal time. Again, I'm not asking you parents to diagnose. I'm asking you not to let relief become a conclusion. So, what do we do with all this? We use a repeatable method. Clarity, calm, and choice. Clarity means you replace a conclusion with a question. Try these 3 phrases. What is the worst credible explanation for these symptoms? What are the red flags that change what we do today? What would make you want to see my child again urgently? That is clarity, not medical jargon. Actionable thresholds. Calm means you slow the confidence spike, whether it's panic confidence or Google confidence. A simple rule: when you feel certain, pause and ask one more question. Certainty is not the enemy. Unchecked certainty is. Choice means you do not need the perfect answer to make a safe next step. Your real choices are often just 3. Home care with clear monitoring, same-day examination by a doctor, or emergency evaluation. The goal is not to win a diagnosis. The goal is to choose the safest path with the information you have. A quick word about AI and health information. AI can be useful for organizing questions. It can help you translate medical language into plain language, but it can also oversimplify, miss context, or sound more certain than it should. So if you use AI, use it like this. Give me questions to ask my doctor, not tell me what this is. And if the answer feels confident, That is your cue to verify, not relax. So here's the message I want you to remember. In child health decisions, the target is not confidence, it is calibrated confidence. Use the 3 C's: clarity, ask for red flags and thresholds; calm, slow the confidence spike; choice, pick the next safe step even if you are not fully sure. If this was helpful, subscribe. On this channel, we turn fear into simple actions you can actually use. And if you want a practical follow-up, watch my videos on abdominal pain, head injuries, and the 3C method. They pair perfectly with this mindset. Take care. See you in the next video.